Sickle cell to me has been the worst experience of my life. Totally the worst. Nothing that I have ever encountered in life can compare to living with sickle cell. Terrible.
Sickle cell disease is a genetic disease that is caused by a single point mutation. We estimate anywhere between 100,000 and 117,000 individuals in the United States living with sickle cell disease.
Any type of tissue in the body can be damaged by sickle cell. It can be the bones, can be the muscles, can be the heart, can be the lungs, can be the kidneys, and can also be the brain.
The main characteristics of sickle cell disease can vary by age. So, for example, in the pediatric population, infections are very common. On the adult side, between the ages of, say, 20 to 30, that's when we see the most painful episodes for those who have them. And we start to see other comorbidities that will develop as well.
Describing the pain of sickle cell, to me, it's like an individual that is being paid to do a job, and he's got a hammer. And with that hammer, he executes the pain over and over and over again at that same spot relentlessly.
The life expectancy for individuals living with sickle cell disease is 25 to 30 years lower than the general life expectancy for Americans. Individuals with sickle cell disease die primarily from lung complications. Acute chest syndrome is the number one reason for mortality in adults living with sickle cell disease. But they also can die of sudden death from unknown causes.
It might be just one name for the disease, but it causes many different types of events that can lead to death. So we need new therapies that will help us increase the survival of those patients.
Preventing in-organ damage in individuals with sickle cell disease would lead to not only increased survival, but also an improved quality of life.
If there was a treatment that can reduce the amount of crisis that I would experience, would I try it? I would jump on it as fast as I can find it. When you go through the crisis, you don't know the duration, and you don't know how long you're going to be in it. So anything that could minimize it, any patient would tell you that, yes, I would take it.